Good morning, afternoon, and evening to everyone who is virtually joining the second day of GEEF 2022. We welcome back you all. My name is Seo Hong-won, Professor of English at Yonsei University. Yesterday, we had a session on equitable vaccine access, and today we will explore another aspect of health. Now, we will begin our first featured session of the day with a discussion on the current state and milestones of global health in South Korea and United States within the context of COVID-19. This session is hosted by the Institute of East and West Studies of Yonsei University and the Graduate School of Public Health at Yale University. I am happy to welcome Professor Kaveh Khoshnood, Professor of Yale School of Public Health, who will be moderating the session. Now over to you, Professor Khoshnood.
Thank you so much. It's a pleasure to be moderating this important panel. As I'm sure you discussed yesterday, COVID-19 pandemic has reminded us over and over again that in order to address and solve global health challenges, it is essential for governments, academic institutions, ministries of health, the private sector, and all other public health stakeholders across the globe to come together and unite. We have also learned that health equity, a key concept in global health, is essential. High-income countries have an obligation to strengthen the capacity of low and middle-income countries to tackle their own public health issues and not rely on those of us in high-income countries to solve their problems. Yonsei and Yale universities have terrific resources and expertise in global health. And today, we will be having a discussion with the leadership of these institutions to get their perspective and insights on how to make global health partnerships most effective. I'd like to start by introducing our speakers. Our first speaker is Mr. Mend, who is an epidemiologist of National Center for Communicable Diseases in Mongolia, working with the National Influenza Center. Mr. Mend came to Republic of Korea to study health policy and financing capacity building in Yonsei University. Our next speaker is Francis Yang, who is a master's in public health candidate at our School of Public Health at Yale University, specializing in social behavioral sciences and global health. Francis first came to Yonsei University's Institute of East and West Studies as a visiting researcher, where he worked on studies examining global health ethics and COVID-19 policy compliancy. And I'm really pleased to thank Francis for connecting Yonsei University and Yale University. Our other speakers are Professor Sun Yoon Kim, a professor in the Department of Medical Law and Ethics, Division of Medical Humanities and Society, College of Medicine, and Director of Asian Institute of Bioethics and Health Law at Yonsei University. Professor Kim is also the Director of Asia Pacific Academic Consortium for Public Health, Korea Region Office, and Vice President of International Cooperation and Director of Korean Association for School of Public Health. Next, my colleague, Dr. Albert Ko, the Professor of Public Health at Yale School of Public Health. Dr. Ko's research centers on the health problems that have emerged as a consequence of rapid urbanization and social inequities. He coordinates a research and training program on urban slum health in Brazil and is conducting prospective community-based studies on rat-borne leptospirosis, dengue, meningitis, and respiratory infection. His research particularly focuses on understanding the transmission dynamics and natural history of leptospirosis. Dr. Ko is also program director at Yale for the Fogarty Global Health Equity Scholars Program, which provides research training opportunities for US and low middle income countries post and pre-doctoral fellows at collaborating international sites. And our last speaker is Professor Sten Vermund, who is the Dean at the Yale School of Public Health, trained as a pediatrician and infectious disease epidemiologist, with focus on diseases of low middle income countries. The thrust of his research has focused on healthcare access, adolescent sexual and reproductive health and rights, prevention of HIV transmission among general and key populations, including mother to child. Professor Vermund has become increasingly engaged in health policy, particularly around sustainability of HIV/AIDS programs and their expansion to non-communicable diseases, coronavirus pandemic response and prevention, and public health workforce development. His recent grants include capacity building for public health in Chad, molecular epidemiology of HIV in Kazakhstan, and COVID-19 vaccine studies in the Dominican Republic and in our own hometown, Connecticut. He has worked with schools and arts organizations for COVID-19 risk mitigation and institutional safety. So I'd like to start by asking Mr. Mentz for his presentation.
Hey, hello everyone. My name is Mend, and as Dr. Khoshnood mentioned, I'm from Mongolia and studying at the Yonsei University. So first of all, thank you for this huge opportunity. It is a great honor to present on behalf of my fellow global students. So global collaboration builds cultural understanding and communication skills, knowledge, and awareness of wider world. The beauty of collaborative approach is that it offers such flexibility so students together adapt as a group and proceed further by helping each other. Our class consists of students from US and Asian and African countries. Our colleagues have a vast experience in their expertise areas and contributing in evidence-based policymaking process in their home country. We have all grown and lived in a different environment and context. However, in Yonsei University, we have united as one group with the same goal, and we respect each other's differences and tailor our approaches. When we share ideas and experience from home countries during the classes, it allows us to see the broader picture of our global threats and how they are responding to it. Besides, what we learn from our classes, we learn from each other's experiences and provide support among ourselves to improve our capacity. Not only education and work, it also applies to our individual development. So new people, places, and diverse experiences are what we are all share in common, and yet these are the things that unite us. Through the interdisciplinary and cross-cultural exchange, we have gained valuable global friendship and connection and diverse aspects of knowledge and education, global solidarity, a common goal and approach to progress towards healthy lives and well-being for all ages, and strong inspiration from our beloved teachers and scholars. So ultimately, we are global students, experts united under Yonsei University roof, sharing the same goal to dedicate ourselves to promoting and achieving healthy lives and well-being in the global community. Thank you. Over to you, Francis.
Thank you, Tsogt, for setting the tone and highlighting the importance of global collaboration. And many thanks to Yonsei University and IGEE for giving me this opportunity to speak. Like Tsogt, my time at Yonsei University and in South Korea has been one of formative discovery and individual growth. It has also allowed me to better appreciate the intricacies of higher level institutional partnerships and emphasized the need for global perspectives and thinking in approaching pressing problems in sustainable development. Individual collaboration and exchange are undoubtedly valuable levers, capable of driving innovation and change, but individual collaboration alone is insufficient in our era of globalization. Strong foundations at the institutional level and an embracing of global and systems-wide perspectives are also critical for the future of sustainable development. This featured session aims to zoom out from the realm of the individual and take a deeper dive into the institutional and global frameworks of partnerships in the context of global health. Through presentations and moderated discussion with global health leaders from South Korea and the United States, this session will explore the importance of global thinking in tackling health and well-being for all. The next generation of health challenges are no longer confined purely to domestic and localized bubbles. They now extend internationally across the world in an interconnected web, bridging not only political borders, but also various academic disciplines and forms of life. This session will also lay out the vision and future of global health partnerships from the perspectives of leading South Korean and American academic institutions. Institutional level partnerships are invaluable avenues for promoting knowledge sharing, research collaboration, and interprofessional learning. But they require complex and nuanced planning to ensure success. This session will discuss steps and considerations necessary for ethical, mutually beneficial, and symmetric partnerships, drawing upon the experiences of leaders in global health. The future of such partnerships, taken within the context of COVID-19, will also be discussed. With that, I'm very honored and happy to welcome our next presenter, Professor So-Yoon Kim, representing Yonsei University and the Yonsei Institute of Global Health. Thank you very much.
Good morning and good evening. I'd like to deliver my greetings to all of you. My name is Kim So-Yoon. I'm Professor of Health, Law, and Ethics at Yonsei University. It is my honor to be part of this session, and I would like to extend my thanks to all the participants. In my presentation, I'm going to be discussing the importance of public health and also the importance of institutional collaboration from the perspectives of Korea and the US. Next slide, please. Recently, global warming is becoming more serious, and there's growing attention to the role of global health. We have seen the consequences of globalization, and because of the COVID-19 situation, the role of global health has become more important. When you develop and evaluate health programs in developing countries, you need to consider various social, economic, and political circumstances. It means that you need to apply a more comprehensive approach to developing health programs in the developing world. Therefore, when you carry out a public health project in these countries, you need to consider various aspects, including social, cultural, and economic situations and the necessity for public health and the engagement of local communities. But when you carry out public healthcare projects in other countries, you may notice that there are several issues you need to consider. In Korea, we do have our public health issues. So some may wonder why we need to go for other countries and help them when we do have our internal problems. And also, when there's low level of awareness among the public, they may say, why do we need to go for international collaboration when we have to focus more on our domestic healthcare system? Because they think that we're using our taxpayers' money to help other countries. So when we say that there's a need for global public health cooperation, citizens may demand that there should be legitimate justification and reason for such international cooperation. And if there's no support from the public, it means that we cannot utilize public resources, and this will lead to further constraints and limitations. Of course, you may still be constrained in using public financial resources, but if there's low level of understanding among the citizens, it may be very challenging for you to carry out international collaboration projects. So this means that it is not only a couple of professors' effort, but also the entire comprehensive effort that is needed to convince the public for the need to support other countries for better healthcare services. We need to understand that the world is connected, and we also need to help our citizens understand that we need to help other countries improve their health systems. So because these will help and benefit our citizens as well. And when we are able to share sophisticated knowledge and experiences among the countries, we will all benefit the entire humankind. So this is something that we need to communicate constantly with the public. Only then we will have a better support from the public for global partnership programs. But I like to also mention that there are many challenges in terms of awareness-raising efforts in Korea and also in other countries. So even if there is very good cause and motivation for global partnership, we sometimes have to convince even our colleagues within our institutions. So it takes a lot of effort. There were many events regarding COVID-19, as you can see on the slide. But I think that this pandemic has given an opportunity for Korean people to understand that in terms of global health, we're all connected. Initially, there were many challenges, but as you may know, Korea has been doing relatively well compared to other countries in dealing with the pandemic. And the government was able to promote its pandemic responses to the international community, which helped Korean people feel proud of our healthcare system. So this was such an opportunity. Therefore, compared to before the pandemic, I think there has been raised awareness. Of course, we need to do more. And I know that I need to learn a lot from other countries, and Korean people also think that we still need to improve our own healthcare system. But at the same time, I think a lot of Koreans begin to understand that we have a lot to offer to the developing world. We have a lot to offer to the other countries, and we can make contributions to the international community for global health. In Korea, we have been doing relatively well in managing the COVID-19 situation. In 2020 and in 2021, there were many exchanges between Korean professionals and those in other countries. I believe that there were several factors. We had MERS outbreak in 2015. And after the MERS outbreak, there was a lot of chaos and confusion in Korea. And this was an opportunity for us to rebuild our national responses to epidemics. And we learned a lot from the US CDC and response manuals from advanced countries. Thanks to such establishments and thanks to such efforts that we made back in 2015 after the MERS, I believe that the Korean government was able to respond to the pandemic relatively successfully at this time around. And in addition, there were many disaster situations and emergency situations that Koreans had to go through. For instance, there was a massive subway station fire in 2003, and there was a massive oil spill in 2007, and there was a Seoul ferry sinking in 2014. So these were massive disaster situations that impacted the entire Korean people. So the COVID-19 pandemic, this was another type of major disaster or emergency, but I think Korean people were more confident in terms of their ability to manage the situation. And personally, Koreans have been suffering from air quality issues, air pollution in the winter time, and Koreans began to wear masks for several years. In the beginning of the pandemic, the Korean government did not encourage people to, or did not force people to wear masks because there was a mask shortage. But Korean people were out there purchasing masks, and they made sure to keep their masks on in the beginning of the pandemic. I believe that these experiences have been accumulated for many years, and such accumulated experiences helped Korean people better respond to the pandemic situation. Thanks to the MERS outbreak, we were able to prepare a lot more, but I'm not saying that our system was perfect. I'm not saying that we were fully prepared, but it was thanks to the awareness of the Korean people that they were very supportive in all these measures. So I believe that it is not only the institutional policies and government policies, but also the awareness and understanding of the public, which is crucial because they were cooperative in terms of tracing and self-quarantine and other COVID-19 related restrictions and measures that were well received by the public. And this means that when we try to go out and help some developing countries, we need to understand the level of public trust in these countries as well. So these were our experiences of the COVID-19 situation. Now, how can we understand the social and cultural context of other countries? This was an area that we focused on. Our institute has been collaborating with institutes of other countries, and what we have been learning is the necessity of understanding their culture and their backgrounds. And through these partnerships, we were able to actually learn a lot from what they were doing. For instance, in Africa, how they were responding to their local health problems and how they were able to deal with them. So we were able to learn lessons from them while they came to us and learned lessons from our experiences. So our partners from the developing world, they were able to see their to-be picture by coming to Korea or by interacting with healthcare professionals in Korea. We are not trying to give them any specific model for them to follow, but I think it is a mutual exchange, and it is an experience where we mutually understand each other and we offer mutual benefits. At first, there was some lack of understanding about the differences between systems of different countries. So initially, when we were pursuing partnership programs, there were many challenges because there was a lack of understanding of each other in terms of our institutions and social and economic and cultural circumstances. But I think, therefore, the first step is to build a mutual understanding. The Graduate School of Public Health at Yonsei University has a long history of engaging with global partnerships. We have about 40 foreign students, and we have classes of maximum 20 students. So including those who are graduating in February, we have a total of 40 students from abroad. And there are many students coming from many different countries. So within our graduate school, many students and faculty were able to engage in global exchanges. And I am also leading the Asia Institute for Bioethics and Health Law. And within the public health domain, we need to discuss various issues, including geriatrics and mental health and global health and cutting-edge research. And cutting-edge research, I thought, was going to be different from public health. But even when you're conducting cutting-edge research, you need to learn from other countries. You need to engage in global discussions and global partnerships. And cutting-edge technologies or cutting-edge research findings will have to be shared with the global community. And only when you understand the broad direction and broad need of the humanity, you can take a better step in developing cutting-edge technology and cutting-edge medical techniques. This is a list of some of the activities of Yonsei, GSPH, and our institute. So there are many programs for education, research, and social collaboration. And by engaging in institutional collaborations, I think we can achieve a lot more together than doing it individually. Thank you for your attention.
Thank you very much. If I could please ask Dean Vermund to make his presentation.
Thank you very much. It's a great honor, and I want to thank Yonsei University for organizing this symposium. Can you see my slides all right?
Yes, we can.
Thank you. So this is just a little bit about the Yale School of Public Health, Yale School of Medicine, and some of the work we do in global health training. We have a partnership across our medical and nursing and public health schools. You see faculty from all the schools on various grants from the other schools. So we're a bigger family for these training grants, trying to identify the people who are most qualified to supervise trainees. We largely get our support from the National Institutes of Health, the Fogarty International Center, and sometimes partner institutes like NIAID or NCI for allergy and infectious diseases, for cancer, and others may contribute. There are two major types of grants, the NIH Research Education Program and then the International Research Training Grants. They typically are multidisciplinary, but they may focus on one disease or one set of diseases. But they often bring biological sciences, social sciences, economics, and the like together. So here are the Yale examples I thought might be of some interest to you. So Dr. Albert Ko is the principal investigator of our Global Health Equity Scholars Program, and he's on today's call and will be speaking with you in a moment. It's a consortium of 4 American universities, Yale, Berkeley, Stanford, and Arizona, and it was established about 10 years ago with a focus on informal human settlements. One could think of them as slums, or one could think of them as suboptimal housing zones, areas where billions of people live and have marginal infrastructures. The scope of the training includes a 12-month research training fellowship at one of the partner institutions. We have quite a number of those institutions, 25 of them in 21 countries. And there are about 80 faculty from the US and from the partner low and middle income countries that are participating. And many research areas, I won't go into detail, but they often focus on urban slums, sometimes refugee camps and rural informal settlements, almost always vulnerable populations. We've had an interest in tropical diseases, HIV, non-communicable diseases, and mental health, among others. And these are the numbers of trainees from our program, postdoctoral fellows from the US, pre-doctoral fellows from the US, students, I should say, and then low and middle income country postdoctoral trainees. And with over 300 peer-reviewed publications, 9 of our alumni have actually become mentors in our program. So they were trainees and then they became mentors. The newest global health training program is not supported by the NIH. It's supported by the China Medical Board, and it's called the China Medical Board Global Health Leadership Development Program. It's a focus on improving global health professional education training for young Chinese health professionals who may not have the opportunities in global health beyond the borders of China. So it brings together a network of outstanding training sites in 3 different continents, and Asia, Africa, and South America. And through leadership training and mentored experiences, we seek to offer high quality global health training to the CMB fellows coming from China. And we administer it in partnership with the London School of Hygiene and Tropical Medicine. So this is paid for by this foundation, the China Medical Board, on behalf of Chinese scholars who work networked with European and American partnerships in low and middle income countries. We have one project on what we call HIV comorbidities. So those diseases and conditions that complicate HIV even in the treatment era. And this is headed by the chief of our pediatric infectious disease group and his counterparts at the University of Ghana. The aims are to provide trainees and junior faculty with both theoretical and applied knowledge of research methods. And this can be quite broad, clinical, translation, or laboratory based. And it's a 2-year intensive and mentored postdoctoral research project that focuses on HIV-associated comorbidities. So it's a practical research project in which the training is nested. It's designed also with a mentorship plan to help these trainees become independently funded professionals. We have another project that Professor Altiz and Professor Adiba in University of Malaya spearhead, and many of you know Dr. Adiba, former Minister of Health. And this is the Malaysian Implementation Science Training Program, training 10 implementation science folks. The area of science that looks at why we know something can make a difference, but why isn't it getting implemented correctly? How does one bring a program to scale? And this integrates advanced training provided both by Yale and by the University of Malaya, and trying to build local expertise at that institution. There's an implementation science boot camp. There is a certification program for HIV implementation science, and we are helping develop an implementation science research hub to pull resources together and build partnerships to promote better population outcomes. We have another grant from the NIH, spearheaded by Drs. Davis and Katamba at Yale and Makerere University in Uganda. It focuses on tuberculosis within the context of the HIV pandemic that affects Uganda. This was begun 9 years ago. It builds institutional capacity and implementation research. There have been 53 trainees who've received degrees in the context of an embedded research project, fellowships in mixed methods, so qualitative and quantitative methods, 18 of those individuals, and there's an implementation science incubator to help people become familiar with the methods of implementation science. And you can see here the variety of topics that are addressed in a broadly interdisciplinary approach. We then also have a project from Drs. Vinetz and Gamboa focused on the Peruvian Amazon. So the Peruvian Amazon, of course, is a highly rural area. There is one lonely city, Iquitos, where the laboratories are located, but many of the field sites are in remote rural areas, and some of them are working with indigenous populations, some of the native populations of the Peruvian Amazon. And we seek to train doctoral and master's students in basic sciences, epidemiology, and translational aspects. There is a focus on malaria, but other diseases can also be studied. And there is a formal curriculum and certificate online course for nurses to acquire stronger midwifery skills both in the capital city of Lima, which is not in the Amazon, and in the larger city in the Amazon called Iquitos. And there's a certificate course in medical entomology that's being developed, and there is supporting leadership roles among Peruvian scientists at 2 major institutions, and of course trying to facilitate bilateral relations between Peru and the US, and linking the Peruvians to the NIH so that they can seek funding subsequently. And the last program I'll tell you about is also relatively new, and Dr. Mowafi and Dr. Al-Haj at Yale and American University of Beirut, respectively, have an injury research program. and trying to train independent researchers in injury science at the PhD level, in injury research program administrators and research assistants at the master's level, diploma courses to strengthen research skills of health professionals who are interested in clinical research in injury, and also workshops to increase awareness of injury among government and non-governmental organization professionals. This has included police investigators, school nurses, people working in agricultural cooperatives and the like. And all the degree level trainees are largely being trained at the American University in Beirut, but they come to Yale each year for a short period of time for intensive studies at Yale. Their trainees are assigned a mentor pair, one at AUB and one at Yale, and they engage their research mentors in their areas of research, preferably over a longer period of time. And we work with them on skill building for career development, presentation at scientific meetings, and development of a nascent MENA region injury research network. So here's a group of some of our Ugandan trainees, and I want to thank you very much for your attention.
Thank you so much to all our presenters. Professor Kim raised a very important issue. She mentioned that as academic institutions, we rely on government support, and that requires the public, the general public, to be supportive of funding academic institutions such as Yonsei University or Yale University to get engaged in global health work, to partner with international institutions. But as Professor Kim mentioned, that might not be an easy task. The general public may not be very agreement to that we should spend funds with our international partners. So I would really be interested in getting perspective of how can we make the public, general public, aware of the importance of these international partnerships, so they don't see it as some sort of a wasting of our resources, but they see it as useful for global health. I would be interested if Professor Kim and any of my Yale colleagues want to give their perspective on how we can inform general public about the importance of public health. Professor Kim?
Yeah.
I would be interested in your perspective.
Yes, yeah. Yeah, 감사합니다.
Thank you for the question. This is a very difficult question indeed, and that is why I mentioned it so in my presentation as well. In Korea, in our society, we have various NGOs and public institutions like KOICA and KOFI. They're engaged in global cooperation, and there are many ministries in Korea. They provide support, including Ministry of Health and Welfare. They provide support for global cooperation. But as you know, these support programs are funded by taxpayers' money, so we need to ensure transparency, and we also need to make sure that the results of such projects will have some predictability, and the results will be reviewed and audited. So that is why some professors refrain from joining such projects, because it takes a lot of paperwork and also extra work and time for the faculty. And I think that it is, so I can say that it is very difficult to get such funding, and it is not easy to put together a group of people who are willing to participate in global cooperation. So in many cases in the past, it was more about, let's say, building a hospital somewhere or building some infrastructure or hardware. So in the past, there was a perception that such hardware projects would be abused or they would not be successful or effective in the long run. And so there was a level of mistrust, I believe, even within the educational institutions and also the general public. And there was suspicion among these institutions. So there is a mistrust in the public. So what I want to say is that institutional cooperation in the long run will have to be carried out for global health at the university level or at the institute level. For instance, a Korean university is working with a university in another country, and this university, because it is by nature an educational institution at the same time, it will have a broader effect on developing the professional capabilities in that country. So rather than giving them some hardware, I think we need to have more long-term engagement at the institutional level, especially educational institutions.
Thank you very much. Dean Sten, Vermund, you mentioned that many of these training grants that you described are funded by Fogarty International Center, which is part of the US National Institute of Health. And as I recall, during the previous administration in the United States, there was even a push to cut all the funding for Fogarty. But thankfully that did not happen. And Fogarty International Center, which supports, provides funds for international collaboration, is now being better funded. What are your thoughts about this notion of getting the general public more interested and better understanding of the importance of international health? I remember reports saying that American public, some of them thought that US is spending 25% of its total income for international work, which was completely misinformation. US spends far, far less than that. So what are some strategies to inform the general public about why international health is important? So hopefully that means it translates into greater funds for Fogarty International Center coming to academic institutions so they can do international collaboration.
Well, Dr. Khoshnood, you are absolutely right. The U.S. government spends just a little bit more than 1%, I think it's a little less than 1% of its budget on global development, including health. So when the American taxpayer thinks that we're spending 25%, it's wildly incorrect. So that's one thing we can do, is we can point out that our country is actually giving a very modest amount compared to some of our European counterparts, for example, who those countries may give 4% of their income for international work. So I think the compelling arguments include the globalization of the economy of the world, where high income business persons are doing business in lower income countries. It's in the self-interest of the high income countries to control disease, to protect their own business interests. That may sound a little cruel, but self-interest is one argument that can be made to protect the military troops of one country that may go for humanitarian aid to another, or hopefully not for war. But a second argument has to do with discovery, that we may discover things about diseases in lower income nations that not only help those nations, but also help us. And that might be diseases that are endemic in our country, like research on COVID would benefit both the high income and the low income country, or it may be something that we would be transiently exposed to when we are visiting those countries, like malaria. And a third reason, I think, has to do with global issues at home. And, you know, the reality is, we may learn things about managing diseases in lower income countries that we can apply back in our own home countries. Both in South Korea and in the US, we do have poverty pockets. We do have areas where poorer people, lower income people live, recent immigrants who may not speak the language well, refugees. So we may have lessons that we learn from our international partnerships that we can actually apply in our own home countries. So those are three reasons, I think, why one can argue. Perhaps the biggest reason is foreign relations. Some of the political scientists talk about hard power, and that has to do with military might and threats. And then there's soft power, economic aid, economic assistance, issues around health and global health and assisting countries to alleviate human suffering and disease and death. And soft power, we think, can be very influential, improving Korea's relationship or the United States relationship with low and middle income countries around the world.
Thank you very much for that response. And I think it's particularly challenging if there's not a very good political relationship between countries. That will make it even more complicated. COVID-19 has reminded us that international partnership between academic institutions across the world is urgently needed. But I want to ask perspective of the panelists about how academic institutions should prioritize their partnership. There are so many countries around the world. We, as academic institutions, we don't have the capacity to partner with everybody. So we need to prioritize certain countries, certain institutions. How do we do that? How do we come up with that priority list? And also, what kind of health challenges should we be focusing on? There's a lot of interest in infectious disease, and of course, it makes a lot of sense to make sure we can partner with other institutions to tackle infectious diseases. But what about cancer care? What about injuries? What about hypertension, obesity, all those other topics? And the final thing I wanted to ask is, how do we make sure that these partnerships are equitable, that they're beneficial to both institutions? Especially when we're talking about high-income institutions partnering with with institutions in low middle-income countries. So those are sort of three things I wanted to ask: how to prioritize our partnership, how do we select among all these countries that really could benefit from our partnership, how do we prioritize the particular health issues, challenges that we want to focus on, and also how do we make sure this partnership is equitable? If Professor Kim would like to start, you're welcome to.
사실
Thank you for the questions. I've been asking these questions myself as well. So these are some of the big questions that I've always been thinking about. I may not have a lot of experiences, but there was a Yonsei University in Ghana, and we have been continuing our projects together for several years. And before this project began, we got some funding support from KOICA for child-mother health in Ghana. So we already had the local experience. We were already there on the ground. So we went there to support for mother and child health. But as we were there, we realized that there was a need for a partner institution. So US University was our partner institute. And then we learned from this institute that they would like to learn cutting-edge technology and research from Yonsei University because we were good at that. Initially, our intention and our scope of work was about mother and child health. That was the proposal that we prepared. That was the project we prepared. But when we were actually there, they said that they were pretty good at taking care of mother and child health, but they rather wanted to learn cutting-edge research from us. So initially, it was our priority that we had in mind initially, but when we went there, we were not able to satisfy their needs because they had a different idea. They had a different demand. So I think that it's crucial to get the requests and the demand from the partner stream first. For instance, they are asking for genetic research, genetic code construction. In other words, there was a very strong need for learning cutting-edge research so that they could be on the same level with us. So I think that listening to the voices of the local institutions is number one priority.
Thank you very much. Professor Albert Ko, I know you're the head of a global health equity scholarship program, and Dean Vermund mentioned there's collaboration in many countries around the world. Could you tell us a little bit about that initiative, that project, and what are some of the lessons you've learned from that collaboration?
Well, thank you very much, Professor Khoshnood. And let me just start off to say that to thank the organizers, and I'm especially honored to be invited to talk. First, because I'm a Korean American born here in the United States. Second of all, because of the topic of global health. My parents, my father was from North Korea. My mother was from South Korea. My father, my aunt, and my grandmother had tuberculosis, which is really a nice paradigm for a global health problem. And I think third of all, and this resonates with what Professor Kim had earlier said, the amount of enthusiasm that many of us have about the contributions that Korea could make for global health. I think first of all, Korea has one of the longest life expectancies in the world. And so there's much to learn about the social determinants of health and how that can help countries like where I have worked for the last 30 years in Brazil or other countries throughout Africa, Asia, and in the Americas. The second, I think, was just an example that really highlights the potential and the capacity that Korea can offer is the response to the MERS outbreak. And as Professor Kim had mentioned, and all that benefits that Korea, in their response to the MERS outbreak, was able to harness in order to address the COVID pandemic, where in Korea, mortality rates are 20 times less than what we experienced here in the United States. So this is not only a discussion between developed and developing countries, it's a lesson between countries. There's much for us here in the United States to learn from COVID. I think getting to your question, but I'd like to just frame it a little bit more, Professor Khoshnood, in your prior questions about how to prioritize partnerships and what kind of health challenges. Well, first of all, I think global health it's not a racing boat. It doesn't necessarily speed ahead. This is something more like an oil tanker, which goes slowly but goes far. And I think what we all learned, at least we've learned here in the Global Health Equity Scholars Program, our Dean Vermund, who's a hero of the AIDS epidemic, is that really long-term investments and long-term objectives will provide much greater benefits than short-term investments. And really when it comes down to it is that people make a difference. It's not necessarily equipment or buildings or monuments as Professor Kim said. So when we're thinking about long-term capacity building, we also have to think about long-term training. And that's the core value of these training programs. These training programs are not just only by the National Institutes of Health for international centers, but also throughout the world. The United Kingdom has them, France has them, and hopefully Korea will be building their robust training programs to build capacity in people capacitated to make a difference abroad. I think the last point I'd like to make is prioritizing health challenges. So we're at a time where we're in a transition when we think about global health. Before it was much of the, global health, the global benefits, the major achievements of global health were made by infectious disease physicians, and epidemiologists, such as yourself, Professor Khoshnood, our Dean Vermund. But that paradigm is going to change. If we think about the future and what's going to be driving health, it's going to be not necessarily disease oriented, but it's going to be process oriented. And if we think about what our children and our grandchildren have to face, whether it's climate change, rapid urbanization, rapidly aging population. Those are the challenges that are going to spill over into deleterious health impacts. And so we have to prepare a new generation of global health leaders who are going to be more process-oriented and disease-oriented, who are able to not only do mitigation, but they're going to be able to do adaptation. And they're also going to have to be steeped in multidisciplinary initiatives. And then finally, I think among all this, we're living in a dramatically, increasingly inequitable world, where differences within countries, in our own country here in the United States, or between countries in the world, that gap is getting wider. And that's, again, resonates with the core values of the Global Health Equity Scholars Program, is how to address not only issues and the needs of countries and populations and people, but how to address these issues of social inequity at various scales and how that influences health.
Thank you very much, Professor Kaveh. I think you mentioned the need for new leadership in global health, and that's absolutely true. We've been struggling with many global health issues, HIV/AIDS, malaria, tuberculosis, cancer, mental health, for decades or centuries. And we've only been able to eradicate one infectious disease, smallpox, globally. So clearly, as you mentioned, there's a need for many, many bold, well-trained new global health leaders. I would be interested in both the faculty perspective as well as the student perspective on how we can inspire more students to get passionate about global health, and also how we can train them well in our own academic institutions for them to tackle global health issues. I don't know if Professor Kim, if you would like to start by saying how we could train and inspire more students to get interested in the global health field, and also train them so that they can make a difference.
Thank you for the question. That is also one of the issues that I've always been thinking about as a faculty member who's teaching and training our next generation. I don't have an answer myself, but as you may know, it is not only just teaching them some theories one directional, but rather engage students in a collaborative manner. I believe that on-site experiences and experiences on the ground is crucial. Because of the COVID-19 situation, we were not able to invite foreign participants and help them go and look around. But I think that it is actually important to go to the site. For instance, a site in Ghana, we make sure that our students go there and visit the local site and get first-hand experience. And we also send students to WHO for internships, 3 months and 6 months internships, such hands-on experiences so that they can see firsthand what is happening on the ground. Giving such opportunities to our students and trainees is crucial because they can grow a lot and they can absorb a lot and learn from these experiences. So I think we need to expand such participatory opportunities for students. It's not just learning from the textbooks, but rather be on the ground so that they can have all these experiences firsthand.
Thank you so much for that very useful comments you made. Dean Vermund, what are your thoughts about getting more and more students inspired about global health and also training them to make sure they are prepared to tackle these various global health issues?
There has been considerable interest in our students, our public health students, our medical students, our nursing students, even our undergraduate students in global health. One can point perhaps to the HIV/AIDS epidemic, now of course COVID-19. There has been a lot of attention to the work of Paul Farmer. There have been leaders at many American institutions who have put global health on the map. Dr. Albert Koh is a perfect example, and you are, Dr. Khoshnood, putting global health in front of students who get very excited about the impact that they can have in global health. You know, you can work hard in your career in a high-income country, and you can improve health this much. But if you put the same amount of effort into a low-income country environment, you can improve it this much. That sort of metric, that the inputs yield a much greater output when you have greater health needs. And many students understand this well and are believing in soft power. They're believing in their high-income nation, be it the US or Korea, is able to make a difference in the world by doing the right thing, and at the same time building friendships across countries and across nations, across peoples. So we do need to offer our students a rigorous curriculum. Global health has to be taught just as rigorously as health for the US or Korea, and it often is made even more complex by economics, by anthropologic issues, by health systems issues. So we need to be tackling these issues very rigorously as academics and preparing our students so that if they go into global health, they're doing so responsibly and effectively.
Thank you very much. We have 2 questions in the chat box, but before I get to those questions, I'm going to turn it over to Mr. Mend and Francis Yang. As students, you both seem very interested and passionate about global health. Could you tell us what got you interested in global health, and also what can academic institutions do to support students like you to become leaders in global health? Mr. Mend, if you would like to start, tell us what got you interested in global health.
All right, thank you. So to be honest, the greatest admiration for global health came from movie. And it was a movie from The Contagious. So just by looking at the movie, I realized that, you know, just as the Dr. Vermund said, how much that this much of effort could be bigger in different countries, in a different context, in a different situation. So that was the biggest motivation that I've interested in a global health. And for institutional organization, I think, for example, I'm sitting in the Yonsei in Seoul, so it's a very, very big opportunity for me and for our country. So using these resources and all those things I've learned back to my country, so I can encourage more students to come here and collaborate with the other international, at the international level, and, you know, to aim for a better future. Thank you.
Thank you. Francis, what got you interested in global health, and what can institutions do to help you grow as a global health leader?
Thank you so much, Dr. Khoshnood, for your question. My interest in global health actually began domestically while I was working with low-income immigrant populations from Hong Kong and mainland China who were living in the California Bay Area. I was interacting with them and noticing language barriers, familiarity with the United States health system, and started to think how I can start helping them before they even got to the United States. And also working in the emergency room of public safety net hospitals, there's been very interesting programs combining Chinese traditional medicine with the Western health system, where acupuncture has been used for pain treatment, and really combining those interesting perspectives, diverse treatment plans, that really kickstarted my interest in global health and eventually led me to South Korea. And I think one big thing that institutions could definitely play a role in is actually language training. I think a lot of one of the biggest obstacles for effective research or getting the most out of a global health experience is communication and being able to interact with the local populace. And Yale does have some language resources. So there's a fields program and the directed independent language study, which focus on one-on-one language training for a language of the student's choice. So for myself, I was focusing on Mandarin Chinese and Taiwanese. And I think if institutions can provide avenues to boost a student's language skills in the global health sector that they're interested in, I think that definitely plays a very valuable role in student experience.
Thank you very much for those insightful comments. So one of the questions in the chat box is, what challenges, financial, logistical, geographical, or cultural, have you experienced while building healthcare capacity in low-middle income countries? And how did you overcome these challenges? Again, there's a question about the range of challenges, financial, logistical, geographical, cultural, that institutions in high-income countries have experienced while trying to build healthcare capacity infrastructure in low-middle-income countries, and how you were able to overcome them. Professor Kim, would you like to start?
Thank you. Yes. Of course, financial challenge is always there. When you're carrying out a project, when you do a project, there's this issue, financial challenge. Sometimes you have to do a matching fund, so funding on a matched basis. So securing funding is a crucial issue. And at the same time, we are bounded by the scope of the project that is funded. So the scope may have some limitation where we wish to be able to do more, but we're limited by the scope. Another challenge that I want to discuss is related to some of the expectation management. Let's say that there's this low-income country where they are asking for something that may not be legitimate, but they may demand something that is not really proper. So there's this ethical issues. Sometimes they may ask for some monetary benefit that is not ethical per se. And they will say, oh, it is a cultural thing. And in our culture, this is something that we need to get. But then we are not able to do so. So there are these conflicts in terms of ethics as well. So you may consider them as cultural gap or social gap. So to what extent are you going to make a compromise? To what extent are you going to accept their practices when these such practices are not acceptable in our culture? Because let's say if you say yes to such requests, later it may be found out and it may cause problem or it may undermine the credibility of the project. So these are some of the practical issues that I think we need to be able to deal with. And as for certain funding or spending, we would always say that the funding institution demands transparency, so we're not able to do this and do that, even though you're asking for them. So we're trying to convince our partner, and we're trying to make sure that there's a high level of transparency so that I will be able to avert any risks, reputational risks and other financial risks involved in that. And that was what I did to address this challenge. But in other projects, I heard that such ethical issues are also part of the challenges. So that was one of the big challenges for myself.
Thank you very much. I'm going to come to that ethical issue, but before that, if Professor Albert Ko or Dean Vermund want to give us their perspective on some of the challenges that you have encountered in international collaborations that you've been doing over the last few decades, and how you overcame some of those challenges. Who would like to go?
Well, I'm going to keep my response short because I think Dr. Ko has a very interesting 3-decade partnership in Brazil that I would like him to share with everyone. I do think the key is having an in-country partner or more than one partner with whom one has a strong tie and a strong alliance. And rather than high-income country people coming in and trying to do something, you work through your in-country partner. Your in-country partner is really the change agent, and you are their guide, if you will, and you are helping with funding and you're helping with technical support, but the change is actually coming from the individual in the lower income country. But Dr. Ko has quite a story to tell about his long-standing partnership in a single country with a single institution that I would love him to share.
Thank you, Dean Vermund, for that. Yeah, so just as a background, I've been working for the last, well, our group has been working for the last 30 years with the Brazilian Ministry of Health, and particularly specifically the Oswaldo Cruz Foundation, which is the National Institutes of Health equivalent organization in Brazil. It is also responsible for vaccine and pharmaceutical drug production. So it is a very interdisciplinary, very unique interdisciplinary organization that really ties together both research, academic research, and public health. And maybe some of the lessons learned in thinking about kind of the challenges. So the first challenge, of course, for a country in Brazil when I arrived in 1995 was in hyperinflation. The inflation rate was about 300% per year when I arrived. And so you could, see, first of all, the challenges that posed in terms of funding and in reliance on external funding. And I think, going back to the point that Professor Kim had said, the cycle, the funding cycles make it very difficult, for when we're thinking about long-term capacity building, training, investment. If we invest in a young, bright PhD student or a medical student, it takes 10 to 20 years for that person to make an impact as an academician, but also in public health practice. So that is the first structural challenge that we've had. Our response to that was to leverage, just like the stock market. We would write for funds from the European Union, from the Brazilian Ministry of Health, from the United States, so that we could leverage opportunities and also leverage currency exchange problems that would pop up. The second problem that, structural problem that we had to face is really the divide between academic research and public health practice. In the end, all of us strive to save lives, to improve the well-being of our populations, but from very different angles. And just as in the United States, we have those divides were very acute in Brazil. And this is one essential component of global health, is how to navigate and how to create synergies rather than challenges. The priorities for academic research is often grants and publications. The priorities for public health practice or public health practitioners is often how many programs you set up. But in the end, it's creating that synergism. And we've done that in Brazil by working with particularly the Brazilian Ministry of Health and the Oswaldo Cruz Foundation, which was intrinsically multidisciplinary and combined both academic research and public health. A good example of that was the first yellow fever vaccine, was actually tried and tested in Brazil, developed by the Rockefeller Foundation back in the 1920s, but produced, implemented, and evaluated in Brazil. I think the third issue is the issue going back to really the importance of social equity. In many countries, and Sten emphasized the importance of in-country partners, but in many times the in-country partners that we work with come from very different communities and very different classes than where the largest disease burden is within those countries. In trying to navigate those differences, not only between countries, but within countries and within classes is key. And one way that we've done that was to create a community participatory model, which combined not only the researchers in the Brazilian Ministry of Health and universities, many of them coming from the upper classes, but including people in communities and for ourselves, urban slum, our informal informal settlement inhabitants, and having them have a voice in not only implementing the solutions for the public health prevention for their communities, but also developing those solutions. So those are just three examples of kind of the structural problems that we had to face, and I think probably resonate throughout many people's experiences, within global health.
Thank you very much. The notion of global health ethics has come up a number of times by Professor Kim. Francis, I know, has an interest in global health ethics. I would like to ask your perspective on how we can ensure that our students who are interested in global health work are well prepared in anticipating the kinds of ethical challenges that are very likely to come up when they start getting involved in global health work. What sort of training can we offer them? How can we prepare them? I would love to get both the faculty perspective, but also I want to ask the students, particularly Francis, who has an interest in this topic, about what kind of training may work in order to prevent sort of students not being prepared to deal with ethical issues in global health work. Professor Kim, I know you have a particular expertise in ethics. I really appreciate to get your comments first.
So should I go first?
Yes, please.
예.
Okay. When you think about ethics, it is about certain norms and certain cultural practices and the level of acceptance. So when you think about ethics and its definition may vary depending on different countries and different societies, and their cultural expectations and norms are all very different. So you need to have a good understanding of your partner country and your partner institution. Of course, we have universal ethics, such as research ethics and other ethical principles that we need to abide by. But in addition to such universal ethics, we need to understand the limitations and the level of acceptance of ethical practices in different countries. So gaining that understanding is a first step. And then you need to make a comparison between what is accepted there versus what is accepted here. And then you need to be able to have such comparison and understanding to set the boundaries that you may remain within. So I think this entire process of understanding their ethical norms is crucial.
Thank you for that. Francis, I know you're actually devoting your master's thesis on global health ethics. Can you tell us about that topic and what you're working on?
Thank you, Dr. Khoshnood. I'm really interested in the different perspectives of what ethics is coming from different countries. So my particular focus for my thesis, I'm interviewing students in the United States, and I've already completed interviews with students in South Korea regarding their views on what ethics is and how ethical dilemmas can be dealt with from their perspectives. And I think a big really theme that I think should be emphasized is that not only is the theory of ethics very important, and this can be developed in classroom training, that's how I first encountered it through actually Dr. Khoshnood's course, but also getting to the field and talking with local experts and who can help guide you through ethical perspectives, cultural differences. Myself, upon coming to South Korea, I found it a bit difficult at first to adjust. I was very afraid that I might do something wrong, and especially having all of the theoretical training, I wasn't sure really how to begin applying my research questions, but with the guidance of the South Korean preceptors, they offered a lot of insightful advice, some insight into how South Korean research works, how to interact with interviewees. So my experience with that has been a very pleasant combination of both theory and practice.
Thank you very much. At the Yale, we have a Yale Institute for Global Health at our university, and 2 years ago, we established a global health ethics program, recognizing the importance of global health ethics. And that program offers training, what we call pre-departure training. So before our students get involved in global health work, we do a series of workshops for them and try to prepare them to anticipate the kinds of ethical challenges that may come up before they go to the location that they want to do their work. And we've been actually learning a lot from that series of workshops and trainings. There is a question in the chat box, quite specific about considerations around giving access, I believe, to health data and security risk in global health partnership. So there's a question about it says health data security risks in global health partnership. I don't know if any of you have any comments to make about that issue.
Well, I can dive in. If we're doing research, we're very strict about data safety issues. For example, complete confidentiality, the so-called locked database in the locked room, and beginning to anonymize the data as soon as is feasible. And you may have a key where you can unlock an individual's visit so you can link the individual, but there's no need to be using names and addresses and this sort of thing. And you keep your research database scrubbed of specific identifiers. And if there are some identifiers, you have that database under very strict security. So that has been our way of doing business, in my case, for nearly four decades. And I have yet to have a serious confidentiality breach. I have, however, had in clinical environments where I've been collaborating with clinicians, say in the President's Emergency Plan for AIDS Relief, the so-called PEPFAR program in Africa, where there have been breaches of patient confidentiality from the clinical database. And so the training and retraining of staff around patient privacy, confidentiality is absolutely essential. And you have to train each new staff member. You have to reinforce that training so you don't have these sorts of devastating confidentiality breaches.
Thank you. Professor Kim, any comments about this health safety data, safety of health data in your partnership with global institutions?
예. 사실 저는 우리
Well, I think within Korea, there is a lot of research being conducted concerning data safety, and I'm also conducting such research. But what about international cooperation? That really is an issue at hand. When we do global health programs, at times we find that there's no awareness about data safety in the local areas. And when we go through IRB, of course, there is data collection, and we do utilize the collected data, but there is very low awareness of data safety sometimes, and at times there is not a properly established internet or computer environment, and so locally sometimes there are great challenges. If we are to expand cooperation to perhaps genetic engineering, and if we were to use a cloud environment, then there could be a leak of data to the perhaps cloud service providers. And so some people ponder over whether or not to conduct such projects at all. Well, theoretically, we would like to have data safety at the level that we see in Korea, but at times that is quite difficult.
Thank you very much. We are approaching the end of the time frame, and I'm not seeing any other questions in the chat box. What I'd like to do is maybe go back to our participant and see if you have any sort of final thoughts you would like to share, including greater partnership between Yale University and Yonsei University, which is something that has not happened. And I'm delighted that we're having this conversation, and I'm hoping this conversation will continue and bring our two institutions together. So maybe I'll start with our students, Mr. Men and Francis. Any last minute thoughts you have about the topics that we've been discussing, including how to strengthen the partnership or create a partnership between Yale and Yonsei University? What are your thoughts?
I can go ahead and address some of those points. I think coming to Yonsei, representing Yale there, and thinking about how to promote partnerships, I really realized how difficult it was, how many moving pieces there were, and what sort of logistics and participation is needed in order to get something off the ground. And I'm really happy that, again, as Dr. Khoshnood mentioned, that we're having this conversation through this forum. And I really think that it would be great to encourage more such symposiums and future conversations, which have been actually helped by the remote nature of these forums. So I'm definitely looking to more of such conversations in the future between our two institutions.
Mr. Men, any thoughts from you?
Okay, so thank you. So I've never engaged with Yale University before, but you know, it's really good. It was really great to sort of, just to hear from all those professors their opinions about global issues and how the partnerships should be combined and how we should work together. And it was really honored. I'm very honored to participate in this forum, and I'm very glad on behalf of my global students and my fellow classmates. So thank you.
Thank you, Mr. Men. Professor Kim.
예, 감사합니다. 저도
Thank you very much. This seminar was a wonderful experience for me, and I was able to share the challenges. So I was very happy to see that some of the challenges that I've been experiencing were also experienced by others. So these were common challenges that we all encounter. So this was a wonderful experience. In Korea, it is not easy for a faculty member to learn from other faculty members or colleagues. Of course, we attend academic seminars, but there were more teaching opportunities than learning opportunities. But this particular session was a learning opportunity for me because I was able to learn a lot from these participants from Yale University, and I was also able to share my experience. So thank you. I hope to continue our dialogue.
Thank you so much. Dean Vermund, I know you have another call coming up, so if you have any last minute thoughts before you leave for the next call.
Well, I want to highlight that one of America's greatest Korean American scientists is on this call, Dr. Albert Ko, and I will turn to Dr. Ko for all guidance in our partnerships in Korea. And we need Dr. Ko to get to Korea in the very near future. COVID has prevented him from making his periodic visits. And the notion of Yale working closer with Yonsei is very appealing. And we could even have the kind of triangle relationship working in low-income countries, but bringing the strengths of both our institutions to those sorts of projects. Thank you.
Thank you very much. Dr. Ko.
Yeah, thank you again, Kaveh, and thank you, Sten, for those very nice words. I can't add anything more than what the other speakers have said. That it's an honor to be participating in this panel. I've learned a lot, quite a bit from the presentations of Professor Kim and from Dean Vermund and the students. There's much work to do ahead, and doing it together is always good, better than doing it separately, especially in terms of global health. So we look forward to future collaboration with Yonsei University, and especially with training of students such as Mr. Yang and Mr. Men.
Thank you so much. Thank you, everybody, the panelists, for a wonderful conversation. Hope the participants benefited from this conversation, and hope to see you soon. Take care, everybody. Have a good day. Bye-bye.
Thank you, Professor Khoshnood and panelists, for your discussion on the challenges you face in global health. I was particularly impressed by your concerns about the next generation of global health practitioners and the questions of social equity and other ethical issues as you approach the local aspects of global health. Thank you again for this discussion. I know that in the States you've been trying to fit this hour, and we woke up a bit early for this here. And I hope that the Yale and Yonsei collaboration will continue and prosper. Thank you very much.
Thank you very much.